Sure. Good afternoon, Doctor.
Good afternoon.
Please introduce yourself to the ladies and gentlemen of the jury by telling them your name.
I'm Dr. Noelia Alemar Hernandez.
Dr. Hernandez, would you please tell us what it is that you do for a living?
I'm an associate medical examiner here in Lee County at the District 21 Medical Examiner's Office.
And what type of background do you have that allows you to be a medical examiner?
I did a bachelor's degree in chemistry at the University of Puerto Rico. Then I did 4 years of medical school at the University of Puerto Rico as well. Then I did a residency program in anatomic pathology at NYU. And then I did a forensic pathology fellowship program at the Miami-Dade Medical Examiner's Office.
And how long have you been a medical examiner?
After training, almost 5 years now.
Could you tell the ladies and gentlemen of the jury what pathology actually is?
Yes. So pathology is a branch of medicine that studies disease, just like internal medicine is also a branch of medicine.
And what is forensic pathology?
So forensic pathology would be a subspecialty of pathology, just like, for example, cardiology is a subspecialty of internal medicine. And what forensic pathology focuses on is determining the cause and manner of death by examining a dead body, as well as reviewing medical records and whatever information we have to make that determination.
And what is anatomical pathology?
Anatomical pathology is just, when you talk about pathology, you have anatomical and clinical. Anatomical focuses more on studying disease, like organs. So we do a lot of, for example, when you have a biopsy that would get sent to the lab, that's an anatomic pathologist that looks at that under the microscope. So it's not just doing autopsies, you're also looking at a lot of slides to diagnose disease as well in any organ.
Now, over the past 5 years that you've actually been a medical examiner, how many autopsies have you performed?
Probably close to 1,400.
Now, in October of 2019, were you an associate medical examiner here in Lee County?
Yes, I was.
And did you have an opportunity to perform the autopsy of a young lady by the name of Kristine Melton?
Yes, I did.
All right. In general, could you describe for ladies and gentlemen of the jury the medical purpose for conducting an autopsy?
So like I was saying, we conduct autopsies to, the main reason is to determine the cause and manner of death for a decedent, as well as to document disease and injury as well on a dead person.
Please explain for ladies and gentlemen of the jury what exactly a cause of death is.
So the cause of death is the disease, the injury, or it could be a combination of both that causes the death of an individual.
And when you refer to manner of death, what do you mean?
So manner of death is just a classification of how the cause of death came about. So it can be classified as natural, somebody that dies, for example, of old age or just heart disease. It can be an accident, like, for example, somebody that dies in a car accident. Suicide, when somebody takes their own life. Homicide, which is deaths at the hands of another. And undetermined, which is when it could either fit into more than one of those categories, or we don't have enough information to put it into any of those categories.
Now, let me draw your attention then to the autopsy of Ms. Kristine Melton on the 8th of October of 2019. Would you please describe for ladies and gentlemen of the jury how you began conducting the autopsy of Ms. Melton?
So when we first received the body, it's sealed and locked in a body bag. So we begin the autopsy by doing an external examination where we document everything on the body, things like height and weight, and just the general appearance of the deceased, as well as any injuries or any markings that might be on the body. And we also collect evidence as well while we're doing the external examination.
Would you please tell us what, if any, injuries that you observed on the body of Ms. Kristine Melton during that you were conducting the external examination?
She had some small bruises on her neck and the left side of her face, like almost towards her neck, as well as she had some small abrasions, which are kind of, I guess a layman's term would be saying like a scrape or a scratch, as well as some ecchymosis, which is basically like saying a bruise, like when you just bump your hand against something, for example, and you get like a bruise, that would be an ecchymosis. Scattered, she had small ones scattered throughout her body, like her torso and her extremities.
Did you notice any damage or injury to her hands?
She had a minute abrasion on her right hand, and she had artificial nails, and so some of the nails on her right hand were broken or like you could only see fragments of the artificial nails.
And did you have an opportunity to go ahead and photograph all these external injuries that you had just described?
Yes.
Judge, let the record reflect I'm showing defense counsel's previously marked as cases of number 13A, 13B, 13C, and also 13D. Any questions?
You may.
Doctor, I'm handing you some previously marked as cases number 13A, 13B, 13C, and as well as 13D. I see you take a look at those items, see if you recognize those.
Yes.
How do you recognize those?
These are photographs that were taken during the external examination and autopsy of Ms. Melton.
And do those photographs fairly and accurately depict Ms. Melton when you were conducting the autopsy of her on the 8th of October of 2019?
Yes, I do.
Judge, state move states number 13A, B, C, and D in evidence at this time?
Objection. Be admitted. You may.
Now, Dr. Hernandez, I'm showing you State's Exhibit number 13A. Could you please orient the ladies and gentlemen of the jury about the injuries that you are observing in this particular photographs that give you any cause for concern?
So as you can see here, you're looking at the right side of her head, and you can see the upper part of her torso. The number 908-19, that's the number that was assigned to this particular autopsy, to Ms. Melton's case. And then if you looked to the, I guess looking straight at it, it would be below the number. There's like a darker bruise on the right side of her neck. I wish I had a pointer, but oh, there you go. So that's the little bruise I was referring to on the right side of her neck.
And what did that indicate to you?
That she had a blunt force injury or a bruise on that side.
And as we're looking at State's Exhibit number 13B, what are we looking at in this photograph that gave you any cause for concern?
This photograph is the left side of her head, and again, you can also see the superior part of her torso. And in this photograph, the dark, I guess, mark is the best way to describe it in the picture on the between her neck and her shin on the left side. That's the abrasion, or an easier way to describe it. It could be a scratch or a scrape on the left side. And if you look towards her shin, it's a little bit hard to tell with the glare, but there's like a little pink area right here. That's also a little bruise on the left side of her shin.
Doctor, would it assist you to step down off the stand and approach the actual screen itself and allow yourself to orient the jury to what exactly it is that you're referring to?
Sure.
Of course, permission.
Okay. That's true.
Now, the abrasion that you're referring to in this particular photograph, would you please describe for us what gave you cause for concern in State's Exhibit number 13B? Would you please point to the abrasion that you're referring to? Okay. And what gave you any cause for concern as it relates to that particular injury?
Because it's an injury.
You're going to have to speak up louder because there's not a microphone over there.
At this point, I was simply documenting all the external injuries, so it gave me concern because it is an injury and it is on her body.
Okay. And because of its location, does that also give you any cause for concern?
Because it's on her neck, it's concerning given the other findings I found during the autopsy.
What other injury were you pointing out in this particular photograph?
Hard to say, but right here?
You're referring to the bottom of her chin?
Yes.
And what are we looking at when we're looking at the bottom of her chin?
There is a small bruise right there.
I'm going to show you State's Exhibit number 13C that's been entered into evidence. We're looking at this photograph.
This picture is after the hands have been cleaned and the fingernails have been cut for evidence. But these are the two artificial fingernails that you can see.
I'm going to have her speak up louder if you're going to have her up there because I can't.
Just please speak up.
Like I was saying, can you hear me?
Okay.
This picture is after the hand has been cleaned and the fingernails have been clipped to collect evidence. What you can see here is these are the two fingers where the artificial nails, as you can see, are missing, and there's only some small fragments of them left over per nail.
And did these appear to have been broken off?
They appear to be broken off. I can't say when it happened, but they appear to be broken off.
Very well. Now, when we are talking about when we talk about some of this discoloration that is reflected here in State's Exhibit 13B and 13A, could you tell us a little bit about the discoloration that we're observing in these particular photographs?
So she has a mix of lividity and congestion on her face. So lividity is a post-mortem change that is based on the position that a body is in after the person has passed away. So all the blood flows towards the side that you're laying on, and you get this discoloration on the face. And you can also get congestion with there are certain things that can cause the face to get congested as well. Marked discoloration that you can see, as well as around her eyes, you can see it's markedly congested with the little, it almost looks like little red bruises around her eyes.
Do you know when those particular bruises actually occur?
I can give you an exact time frame.
Well, what I mean is, would those have occurred before she died, at the time of death, or after death?
Somewhere between around the time of death or before. It could be either one.
Thank you, Doctor.
You can return to the stand.
Doctor, the external injuries that you observed and photographed of Ms. Melton, after you conducted your external examination, what is your next step in the process?
That's where we do the autopsy, which is what you always see on TV, where we start with the Y-shaped incision. We reflect the skin, and we examine all of the organs. And in this particular case, we actually reflected the skin of the extremities as well to look for injuries.
Okay. When we were talking about a Y-cut incision, what do you mean?
You start at the shoulders, and you go down towards the center of the chest. So that's the top part of the Y, and then you extend it all the way down to the inferior part of the abdomen. So that's the Y-shaped incision.
Okay, and when you say we were reflecting the skin, that means basically pulling it back and opening up the body. Is that correct?
Correct.
And when you conducted the Y incision on Ms. Melton and began the external examination or internal examination of her body, what did you find?
She had hemorrhage on the subcutaneous tissues of her neck, which are the tissues right under the skin. And I could also see hemorrhage over the muscles on her neck. Was the first thing we saw as we were starting the autopsy.
Now, with the court's permission, I'd respectfully request the doctor to step down once again and approach the screen. And
Which exhibit do you have?
State's Exhibit 13B, Judge.
Okay. All right.
Doctor, when we're looking here at State's Exhibit number 13D, what are we looking at?
This is a picture of the neck from the inside. So the more, this area right here, that's the skin that has been reflected towards the top of the head. And these right here, those are the muscles of the anterior neck that have also been reflected upwards as well. So what you can see is there's hemorrhage on most of those muscles on the anterior neck. Here, all of these muscles as well. And what we're doing is we're reflecting those muscles layer by layer to see how deep that hemorrhage extends to. And in her case, when we keep reflecting those muscles, it goes all the way to the deeper muscles as well as on the surface of the thyroid gland, which is sitting right over the thyroid cartilage.
What do you mean when you say that when you began reflecting the muscles, it went deeper?
So we start with the muscles that are more superficial. They start with what's called the sternocleidomastoid muscles, which are the big muscles that are more towards the side right here. And then we start with the next layer on the anterior neck. And once you reflect that, you pull it up, there's another muscle under it. So you keep going deeper into the muscle. That's what I do in cycling.
Does the deeper the muscle and the deeper the discoloration also correlate to the amount of force necessary to create that kind of injury and trauma?
In a way, yes.
What do you mean in a way?
I can't tell you how much force, but yes, in order to make it go deeper, you would have to be a stronger force or a harder object or force.
So the more pressure, the deeper the damage or deeper the injury. Is that right? And when we're looking at this particular photograph in general, there are a number of dark discolored areas around the neck area that indicate injury. Is that fair to say?
Yes, those are hemorrhage, those dark areas.
And that's because the deeper or the more pressure that's used around the neck area, the deeper the injury that's caused. Okay. As you return back to the stand, please. What other injuries did you see on the interior of Ms. Melton?
So when we reflect, and again, it's the same thing, we pull it back, the scalp, which is essentially the skin around your head. There were hemorrhages or contusions on both sides of the scalp. She also had contusions on both lungs. She had a small contusion on her transverse colon, which is part of the large bowel that is going horizontal at the upper part of your abdomen. She had...
Let's talk about the scalp injury. You indicated that there was a hemorrhage there as well? Contusion?
There's contusions, yes, on both sides of the scalp.
What does that mean?
It's hemorrhage on the inner surface of the scalp.
How would one get damage to the interior of the scalp?
So those are consistent with blunt force injuries.
So someone actually striking someone, or the head actually striking something?
It could be either one, yes.
You indicated that there was also damage to the lungs or injury to the lungs?
Yes.
Okay. What damage did you see or injury did you see to the lungs?
So there's hemorrhage on the surface as well as extending slightly into the parenchyma or the inside of the lung. So those are what we call contusions on the lungs, which are also evidence of blunt force injuries.
And when we're talking about contusions, is that a fancy word for bruising?
Yes.
So when we're talking about bruising to the lungs, how much force or pressure would it take in order to do that?
I mean, that's kind of like a hard question to answer. I can't say exactly how much pressure.
Okay. Would it be fair to say that if someone punched you in the lungs pretty hard, that would cause that kind of damage or injury?
If they punch you in the chest, yes, they could do that.
You also indicated that there was damage to the colon area.
Yes.
And would you please describe what injury that you saw there?
Same thing. It was hemorrhage on the surface of the colon, and it's a transverse colon, so it sits towards the top of your abdomen.
And what type of damage did you see there?
That's also a blunt force injury.
And once again, that's actually someone striking you, or you actually striking something. Is that right?
That's right.
Was there any other damage that you saw on the interior of Ms. Melton?
She also had a contusion to her liver and one to her bladder. She had a ruptured cyst in one of her ovaries, but that type of cyst could rupture due to trauma, but it could also rupture due to strenuous exercise and other activities. So I can't say whether or not that was due to the trauma.
Let's talk a little about the damage to the bladder. What did you see there?
So similar to where I was explaining in the lungs, it's also hemorrhage on the surface of the bladder, and it extends all the way to the mucosa, which would be the inner surface of the bladder where the urine is held. So it'd be like hemorrhage on the tissues right there.
And would that also be consistent with blunt force trauma?
Yes.
And as it relates to the liver, what did you note was trauma to the liver?
Yeah. So that one would also be blunt force trauma, the contusion to the liver.
So based upon your complete autopsy examination, can you tell, ladies and gentlemen of the jury, what your conclusion was in this particular case?
So in this case, based on what I was explaining earlier in the neck, how she had hemorrhage extending from the superficial muscles all the way to the deep muscles, as well as the bruises on the outside of her neck. And also she had petechia on one of her eyelids and some petechia on her scalp itself. All of her autopsy findings taken together are consistent with death by asphyxia due to compression of the neck.
You just mentioned petechia of the eye and petechia of the scalp. Can you please describe for ladies and gentlemen of the jury in layman's terms what that means?
So petechia are pinpoint hemorrhage. So they're like a tiny little dot, and they're caused when your venous pressure goes up. So it causes a backup of the blood, and all of that pressure causes your little venules to burst. So you just create this little, like pinpoint, tiny little hemorrhage.
And that would have been as a result of the asphyxiation?
That's one of the causes for petechia, yes.
Doctor, did you also complete a death certificate in this particular case?
Yes.
Judge, let the record reflect, I'm showing defense counsel increase in mark deceased to 14. Commissioner Approach?
You may.
Doctor, I'm handing this increase in mark deceased to 14 as we go with that. Do you recognize that?
Yes.
What does that appear to be?
This is the death certificate for Kristine Melton.
And is that a certified copy of the death certificate?
Yes.
Judge statement would move Stacy number 14 in evidence.
Objections?
No objection.
Be admitted.
I have no further questions at this time, Judge.
Okay.
Doctor, when you, back in 2019, that's 5 years ago. You just like a brand new medical examiner?
Yes, I had recently started at the District 21 Medical Examiner's Office.
Okay. When did you start it there?
September of 2019.
So this was 1 month after being there.
Yes.
Did you take, or as part of your protocol, did you take DNA scrapings from under Miss Melton's nails?
We take the fingernail clippings where they cut the fingernails, and we put them in the little envelopes.
Okay. But you're not, you yourself conducting an autopsy are not looking to collect DNA, are you?
We collect a DNA card from the decedent where it's like a little card with circles, and you put blood from the decedent on it.
Okay.
We collect the fingernail clippings, which I guess law enforcement would use to look for DNA under the fingernails. We'll do swabs if they request us to do a rape kit, like swabs of the mouth, the anus, the vagina. And if there's any secretions or anything we notice on the body, we may swab that as well.
Did you do a rape kit on Miss Melton?
I believe we did, yes.
And what do you do with that when you're done collecting the evidence?
We hand that over. We sign it, we seal it, and we hand it over to law enforcement.
Okay. And just what do you do to use a rape kit? I'm sorry. When you are going to complete a rape kit, what do you do as part of your autopsy?
You mean like how do I collect this? Is that what
Yes.
Oh, okay. So I usually have my technicians assist with that. And before we clean the body, once we open the body bag, we'll take swabs of, so the rape kit usually comes with swabs for the buccal mucosa, it swabs for the vagina and swabs for the anus as well. So we'll do all of those before we clean or start manipulating the body any further once we get it.
Do you as the doctor do those, or are your technicians doing them?
They usually do those under my supervision.
Could the injuries to the neck area occur during rough sex?
Some of the injuries, I guess it's possible.
You mentioned various contusions on the body. Were there contusions on the exterior of the body that corresponded to what you found on the internal examination?
So, for example, one of the bruises on the right side of the neck, there was hemorrhage corresponding to that area. Some of the bruises on her extremity, I don't remember the exact locations, had hemorrhage under the skin corresponding to those bruises. But not all of them had a bruise that you could see on the skin over them.
Well, like you said, petechiae. How long does it take to, I think you said those were burst capillaries?
They're burst little venules, so they're some of the smallest blood vessels in the body.
How long does it take for that for one of those things to burst?
I can't really give you a time frame. That would probably depend on how much pressure you're applying. The higher the pressure, the faster they would burst.
So they could burst in basically seconds, depending on what's happening.
That's correct.
Okay, and you found those on an eyelid. Did you find any in the eyeballs?
She had ecchymosis or hemorrhage in the eyeballs. So I can't say definitively if those were petechia, that they can become confluent. So when you have petechia close together, they can kind of coalesce. So it just looks like one big ecchymosis rather than a bunch of little petechia. But that's pretty much impossible to say if that's what happened in that case.
And how did you note petechiae on the scalp?
When you reflect it on the inside, that's where you see the petechia.
Okay. All right. Nothing further, Judge.
All right. Anything else from the state?
Nothing further, Judge. Thank you.
All right. You may step down. Yes, that's it. You'll collect the evidence, exhibits, and pictures for the clerk.
No objection.
Okay. Oh, I don't. Did they? I don't think they have.
Yes, it should be released.
Okay.
No objection.